Hey everyone, in this video we are going to talk about what is a Glasgow Coma scale, or which is also known as GCS. So the Glasgow Coma scale is a clinical scale that is used to reliably measure a person's level of consciousness after a brain injury. The GCS assesses a person based on their ability to perform eye movements, speak and move their body, and these three behaviors make up the three elements of the scale, that is the eye, verbal and motor. Then person's GCS score can range from 3, which is completely unresponsive, to 15 responsive, and it can never be 0. This score is used to guide immediate medical care after the brain injury such as car accident, and also to monitor the hospitalized patients and track their level of consciousness. The lower GCS scores are correlated with the higher risk of death. However, the GCS score alone shouldn't be used on its own to predict the outcome for an individual person with a brain injury. Then Glasgow Coma scale is used for the people above the age of 2, and they are composed of the 3 tests: the eye, verbal and motor responses. The scores for each of these tests, they are indicated in the table below. Okay, so let's start from the first test, which is the eye or the ocular response. So this can be not testable if, for example, there is severe trauma to the eyes or enucleation. Enucleation is basically a surgical removal of the eyes. So in this case as well, it can be not testable. Then we have a grade 1 when the person doesn't open the eyes. Then if the person opens eyes in response to pain, that would be grade 2. Then if the person opens eyes in response to voice, that would be grade 3. And if the person opens eyes spontaneously, that would be grade 4. Let's move to the other response, which is a verbal or the oral response. So that can be not testable if, for example, there is intubation or non-oral language disability or the linguistic barrier. It would be grade 1 if the person makes no sounds. Then incomprehensible sounds, so it would be grade 2. Inappropriate words, then this would be grade 3. And if the person is confused and disoriented, but he's able to answer the questions, that would be grade 4. And if the person is oriented to time, place, person, and if he converses normally, that would be grade 5. Then we have another response, which is a motor or motoric response. So it can be not testable if there is paralysis or the hemiparesis, and it can be caused by the acquired causes or the congenital or the innate causes. So the acquired causes can be, for example, the post-stroke or the post-neurological injury, and the congenital or innate can be such as the cerebral palsy. Then we have the grade 1 if the person makes no movements. Then the abnormal extension, for example, the decerebrate posture, so that would be grade 2. And the abnormal flexion, that is the decorticate posture, so that would be a grade 3. Then we have if the person performs the flexion or the withdrawal from the painful stimuli, so that would be the grade 4. And if the person moves to localize the pain, so that would be 5. And if the person obeys the command, that would be grade 6. Now, for each test, the value should be based on the best response that the person being examined can provide. For example, if the person obeys commands only on the right side, so they get a 6 for motor. The scale also accounts for situations that prevent the appropriate testing. When specific tests cannot be performed, they must be reported as NT, and the total score is not reported. The results are reported as a Glasgow Coma scale, the total points from the 3 tests and the individual components. As example, you can take a person's score might be GCS 12, so the E3, V4, M5. Alternatively, if a person was intubated, their score would be GCS E2, V, because the person was intubated, so that part would be NT, it means not testable, M, and the M would be 3. Okay, and here you can see in the figure that Glasgow Coma scale can have these ranges. It can be mild if it is ranging from 13 to 15. It would be moderate if it is from 9 to 12. Then if the person has below 8 Glasgow Coma scale grades, then this would be very much severe. Okay, so that was all about the Glasgow Coma scale. Thanks for watching.